following podcast is a production of Radio Felician, the voice of Felician University and the home of alternative rock done right. Download the Radio Felician app via the Apple app or Google Play stores or stream us 24/7 worldwide at radiofelician.com. Radio Felician, the Falcon. Welcome to The Felician Lantern, shining a light on everything nursing. A podcast from Felician University in New Jersey, exploring current issues in healthcare, speaking to leaders in the field, and preparing the next generation of nurses. Your hosts are Dr. Daria Waszak and Dr. Elizabeth Van Dyke, Associate Deans of the Felician University School of Nursing.
Welcome to The Felician Lantern. I'm Daria.
And I'm Liz. I'd like to introduce our esteemed guest, Dr. Daria Waszak, CNO of Newton and Hackettstown Medical Center, part of the Atlantic Health System. Donna has been the Chief Nursing Officer of Newton and Hackettstown Medical Center. She's dedicated nearly 30 years to the nursing profession, being inspired by both her beloved mother and aunt, who were local school nurses who shared their knowledge and compassion at home and extended throughout many communities. Donna has made her commitment to excellence in patient care her top priority from the beginning of her career as a brand new graduate working in various roles in multiple departments. While in her rise to leadership roles, she's participated in shared governance on many levels and led several new programs, including sports cardiology, cardio-oncology, STEMI programs launch at both Newton and Hackettstown Medical Center, and also the Achievement of Nursing Improving Care and Health of Elders designations. She's also led the implementation of leading-edge electronic health record systems and laboratory software systems. Both medical centers earned Level 3 geriatric accreditation for their emergency departments with her guidance. Donna received her Bachelor's of Science in Nursing from William Patterson University, also my alma mater, and her Master's in Business Administration from Seton Hall University. As a member of the Organization of Nurse Leaders New Jersey, American College of Cardiologists, and American Association of Critical Care Nurses, Donna has been a national voice on medicine reconciliation and best nursing management practices. Donna was also recently recognized by Becker Hospital Review and achieved the New Jersey Girl Scouts Women of Achievement Award. We are so esteemed, and we are also honored to have you with us. And recently you were awarded the 2022 Nurse Excellence Award from the Organization of Nurse Leaders for New Jersey. So congratulations on that. Happy New Year.
Happy New Year and good morning. Thank you. I hope you all had a wonderful holiday season.
We did.
And I was privileged enough to attend that award ceremony where you received that award. It's just fantastic. Great work.
And down at O&L?
Yes. That was a great event.
It was a great event. We had a great speaker.
All in.
All in. Yeah, all in. That was great. Thank you for sharing that.
So our topic today deals with something that too many nurses in the healthcare field can unfortunately relate to, which is namely workplace violence. Right off the top of my head, I can think of several occasions in my career personally and also in some of my colleagues' careers where this has personally, has affected us. And I'm sure all nurses can think of something. The statistics are staggering. The Bureau of Labor Statistics reports that the rate of injuries from violent attacks against medical professionals grew by 63% from 2011 to 2018. And hospital safety directors say that aggression against staff escalated as the COVID-19 pandemic intensified in 2020. In a more recent survey by the National United Nurses, which is the nation's largest union of registered nurses, 48% of the more than 2,000 respondents reported an increase in workplace violence. This is more than double the percentage from the prior year. So, Donna, we really would love to explore this topic with you first. But before we get into this conversation, can you just please explain your role to our audience in your what you do as Chief Nursing Officer?
So as you very eloquently discussed in my bio, I've been a nurse for over 30 years, and I've been in healthcare. I started with my was truly had a inspiration from my family. And just to add, my son just recently graduated nursing school and passed his board, so he is also a nurse. So it is truly what I'm going to describe is it's in the blood and it's a family tradition.
Yes.
So I have to throw that out as well. I'm incredibly passionate about patient care and the delivery of care and supporting the team to ensure that they have all the resources. And that's a part of my job, is to ensure that they have all the resources. And resources is defined by a number of different ways. Certainly our most obvious resource and what we need the most is the people. Right? People are our most valued resource. So responsible for ensuring that we have the appropriate resources, but we also need the tools and the equipment, as we saw during the pandemic, where we had these national shortages of protective PPE supplies, right? The personal protective equipment. So that's the other piece of my job, is that we need to ensure that we have the right people in the right places at the right times, and that they have the appropriate resources, including the tools. Tools are physical tools that we use, such as PPE, but also the education that they need and coordinating that. Really responsible for all of nursing practice at both Newton and Hackettstown, establishing practice standards based on national standards and processes and protocols to ensure that we are creating a safe environment, quality improvement, and overall operations under nursing. And we are a high reliability organization, and I am a high reliability trainer, as well as the lead for the safety coaches. And we'll get into a little bit more about high reliability and how it integrates and what the difference is when we talk about workplace violence, and how do we integrate both of those concepts.
So what exactly encompasses workplace violence? Is it just a physical a component, or is there more to it than just the physical, what we think of violence?
Yeah, it's very easy for us to think that workplace violence is just physical, but it goes so far beyond just a physical assault. Occupational Safety and Health Administration, or OSHA as we call it, describes workplace violence as any physical assault, threatening behavior, verbal abuse occurring in the work setting. So that is a really broad topic. By OSHA standards, threats, harassment, intimidation. We don't think about intimidation as a workplace violence, but it really can impact how we interact with patients, how we interact with our colleagues, and how we interact with each other. Emotional abuse constitute workplace violence, and violence doesn't always have to be physical. To put victims in safety, and being impacted by any one of those harassment, threats, intimidation is all encompassing in workplace violence. And I think what's so important is that we understand that definition, and we understand what I will describe as at-risk behavior, and identifying those at-risk behaviors in patients, so that we can protect ourselves. The CDC talks about 4 types of workplace violence: criminal intent, client on worker violence, worker on worker violence, and personal relationship violence. And we see that a lot when we talk about workplace violence. Predominantly nursing is female, although we're gaining many more male colleagues, which is incredible and great. But when we talk about personal relationship violence, it's important for us to acknowledge that as well.
What type of workplace violence are you seeing in the healthcare setting, and what do you think some of the root causes are?
So what we're seeing, so there are many different common reasons for workplace violence. Staff shortages, increased patient morbidities, meaning that they're sicker and they're coming to us with more complex conditions. Exposure to violent individuals. We know that there's a national behavioral health crisis going on. And so more of those patients, what we saw particularly nationally during COVID, we had massive, closures and shutdowns nationally, locally, regionally, and nationally. And many patients were not able to seek the care that they needed for some of their medical conditions and some of their behavioral health conditions, so that we see more exposure to violent patients. the absence of strong workplace prevention programs and protective regulations. So there are legislation that's moving forward to help protect some of that, and that there are barriers to eliminating workplace violence against healthcare workers. And one of the things we need to do is to be able to recognize what those situations are, identify that at-risk behavior, and then de-escalate team members and get the resource. We may not always be the resource that we need, working with our physician colleagues, working with the security teams, and our patient safety officers to collect the data to identify what are triggers in each institution, because we see that nationally, and so we're collecting those statistics nationally.
So you mentioned COVID-19. So have you seen an uptick from your perspective in workplace violence since COVID-19? And do you think that, healthcare workers in general, because obviously, workplace violence could be in any realm, in any field. And certainly we always, unfortunately hear the news in the evening and about what happened during the day, and it's not always healthcare. But do you think that healthcare workers are more at risk as compared to other fields as far as workplace violence?
I think everyone is at risk for workplace violence. You talked about watching the news. Just think, recently over the last, I think COVID-19 had an impact globally, clearly, with how we address the pandemic. But, things were shut down and we were isolated. People were isolated. That isolation creates unintended consequences. Think about all the things that, for speaking non-nursing for a second, when we watch the news, all the airlines that have issues on the airlines and that the planes have to get diverted because there are disruptive passengers on airlines. We hear about the disruption in many restaurants. People don't want to wait for their tables and they don't understand because, the place is half empty because they don't have people to staff them. And people get very disruptive in restaurants. So it is in every asset of our life that we see workplace violence, particularly in healthcare. The American Hospital Association reports that healthcare workers suffer more workplace violence injuries because, of the violence than any other profession. The industry group says that 44% of nurses report an increase in physical violence since the pandemic, and 68% report an increase in verbal abuse. While safety and security are of our utmost importance, the healthcare environment must also create a welcoming and restorative environment for patient and caregivers. So we understand that people are going to, are behaving this way and very disruptive in non-healthcare environments where people are healthy. We are working with in the healthcare settings where people are seeking healthcare where they may not be as healthy and in more chronic pain and in pain, not being able to breathe appropriately. So it can really accentuate some of those incidents.
This is the Felician Lantern, shining a light on everything nursing.
Donna, what has been your experience in regard to workplace violence from the CNO perspective? And also, have you seen workplace violence in some areas of your healthcare system more than others? For example, we would expect it to be more prevalent in the emergency department.
It can happen anyway. And we just talked about all the non-nursing areas, and I just mentioned just a few of them because those tend to make the headlines when a plane diverts and when you hear about some of these disruptions in some of these restaurants. But yes, workplace violence can occur anywhere in an organization, and we have to be very mindful about that. What we focus in healthcare is really, and what we see nationally is the focus is on the entry points of healthcare. And the emergency department, as you just explained, is an entry point into our healthcare facilities. But we also need to be mindful of physician offices, right, in outpatient office practices, because that can be another entry point. The entry points to an acute care setting, or what we call hospitals, is the front lobbies when we're asking people to maintain masking. And so we see and we hear nationally the challenges of masking. And there's a whole masking debate. We won't get into the debate, but the CDC recommends that we continue to mask in healthcare facilities. And it's challenging because there's no mask. Many times there's no masking requirements in the grocery store, at the bank, and the restaurants. But when you cross the threshold of the hospitals, there's masking. So we provide masks, but we do see that's another area opportunity across the country where we do see violence. We also talk about, you talked about the ED, but some of the inpatient settings have also seen across the country an increase in workplace violence because of we talked earlier about the comorbidities. There's polysubstance abuse and much more of that post-pandemic. And so we're seeing some of those patients being much more disruptive in the inpatient settings. So it is really in every aspect of life where we have to be aware of our settings. And I think that's a big point to talk about is it's not just in a healthcare. Yes, we're here focusing about healthcare, but we need to, with a high reliability mindset, it's not just about, it's a change in what we do and how we act. And it's not just in our building and in our local spaces, but in our homes and in our communities. And how do we take those lessons and bring them back and look for some of those at-risk behaviors in the community so that we can be mindful and mitigate some of those.
Now, I know, like you mentioned, as far as COVID is concerned and pre and post-COVID, it's like COVID is like kind of like that line that kind of changes what was in the past versus what we're currently facing. And, I can think of in the past in my, 20 plus years in nursing, thinking about, how we dealt with in the ED, how we dealt with a disruptive family member or patient. And, now post-COVID or during COVID or however you want to define it now. So what do you think has changed as far as the response to workplace violence, whether it be, emotional, whether it be physical, whether it be threats, how has the hospital systems, how have they start to change their focus to kind of, shut it down and try to mitigate some of what's coming through the door?
So I think there are a couple different ways that we do that. We're looking for the American Hospital Association and other provider groups are urging Congress to enact bills to protect healthcare workers from violence that is modeled after protections for aircraft and airport workers. So I think, that at a national level, those are some of the things. Some of the other topics of conversation are really is the communication. We just need to start talking about workplace violence. And, you started out by asking the question, is it just physical? And I think people think that it is just physical, and it is so much more than that. So I think we really need to educate our communities. We need to educate our students at an undergraduate level and at a postgraduate level, what truly constitute workplace violence. And we need to talk about them. Part of the high reliability journey is really having those conversations and identifying patients, people, family members with that behavior. When we start to see that escalation and we start to identify what is escalation, educating on escalation, and then educate the communities, our nursing students, our team members, our colleagues on how do we de-escalate. And sometimes that's removing ourselves. Sometimes that's bringing in additional resources, which may be, behavioral health clinicians, physicians, different, behavioral health nurses, as well as security personnel to help de-escalate. The other thing that we're seeing nationally is that, we work with our patient safety officers across the country on education. And it's the education of how do we verbally de-escalate, but also how do we protect ourselves, hands-on education that we can protect ourselves. So we understand that if a team member was put in a situation where they might get hurt, how do they remove themselves safely from that situation? And then it's all about escalation. We talked about escalation, but what does that actually mean? Who do I call when something is happening? And being aware when to call and then who to call. And then if there's not an appropriate response or a response that is what they feel is appropriate, that we continue to escalate, which is also a part of our high reliability journey. So I think those are things that we work on locally, regionally, but also with Congress to enact a bill to protect healthcare workers.
You're listening to the Felician Lantern, shining a light on everything nursing.
Are there any particular tools that have been effective for employees, managers, administrators in de-escalation?
So the organization, the American Association of Nursing Leaders, and what we call the ENA, which is the Emergency Nurse Association, recommend hospitals and healthcare systems to follow the following principles to expand workplace violence. You talk about how do we prevent. Part of that is ground workplace violence prevention programs using evidence-based strategies, and we talked some about those. The de-escalation and the hands-on training. Employing comprehensive solutions, recognizing intersecting layers of intrusive customer, relational, and organizational violence, defining it, putting the mitigating workplace violence by establishing support through the breadth of an organization. Once somebody is a victim of workplace violence, we need to offer them the right support, the emotional support, physical support, and we need to care for them. We talk about creating the culture of safety and the healthy work environment and HRO, ensuring interprofessional teams, leadership, team members, patients, and visitors are committed to reporting incidents and acting to prevent further violence, and emphasizing accountability regardless of the role or discipline to hold up foundational standards of nonviolent behavior. So those are just some of the few recommendations, and we talked about them in terms earlier as well.
Do you think nurses just kind of accept this as part of the job? I mean, I've heard that before, and I've even heard like a few years back some nurses saying, "Oh, workplace violence again. Oh, I've heard enough about that." What do you think nurses think about workplace violence, and has it changed?
So I hear some of the same things, and from when I meet with my colleagues, they think it's a part of the job, and it really, it's not something that we need to tolerate, which is why it's so important we educate on what the definition is, and we continue to talk about workplace violence in a conversational manner, in a non-threatening manner and non-punitive manner, and talk about what it means, how do we de-escalate, and identifying those at-risk behaviors and doing the proper hands-on training. And our roles in leaders across the organization and across the country is to really, really put workplace violence in the forefront and talk about it. What is it? Because what it means to one person when we talk about intimidation and threatening behavior may mean something different to somebody else. So I think biases come into that conversation. We have to remove the biases and really have a very candid conversation about what it means and how do we address it, and what are your tools. At each organization has very similar tools that we're talking about here, but the names and the titles associated with some of those tools and resources may be different. So I think it's important for students to be educated on that and what it means, how to protect themselves, and who the chain of command and escalation process is.
So you mentioned a lot about students. So, coming from Felician and our perspective as far as education in both undergraduate and graduate students, how can nursing faculty help prepare students, the undergraduate students who may not have ever stepped foot into a patient care arena before, or our graduate faculty who are preparing, advanced practice students? How can we better prepare our students to handle the challenges and the realities of workplace violence?
So I think it definitely needs to be a part of the curriculum. We talk about what to expect when we educate our undergraduate students on diabetes or heart failure, right? We talk about these different ailments, or we need to talk about workplace violence in the same kind of context. What does it mean? How does it interact? How do you view workplace violence? And, how do you see it? And, what does it look like from an intimidation standpoint? What does it look like from a verbal abuse standpoint? So that we can learn to identify it at that level so that we can work on preventing it and escalating it at what we would call, those are the at-risk behaviors when people are starting to escalate. And I think it's the education of what workplace violence is and how they relate to workplace violence. I think it needs to definitely be a conversation. When you walk into a clinical setting, you're not sure, assessing their environment, but part of that environment assessment, right? You walk into a room when you're seeing a patient in a clinical setting, in an outpatient setting, you see, are they agitated? Are they fidgety, right? We talk about all those things, but we don't always put it in context with workplace violence and how do we mitigate some of those circumstances so that we protect our team members and our students. So I think education is really the way to go. But really talking about risk assessment, verbal de-escalation, and then, how we protect ourselves. And then the resources and tools available to us needs to be a part of every curriculum.
Sounds like a great, case study, ongoing case study, like developing and being able to talk to the students and, even role playing and walking through different situations. I could definitely see that being a positive influence for students for later on when they move into the actual physical healthcare arena. So,
and I think it's important. Hopefully people are not they're not impacted by it, but for people who witness it or have been a victim of workplace violence, it's important to get their feedback and listen to what they have to say about the events, how they make them feel, and, what happened leading up to it. You read so many stories. I was reading several stories, and you read them in the journals about sometimes things come out and, the violence comes out of nowhere, and it's very unpredictable. So we have to create settings so that we protect ourselves from some of that unpredictable behavior.
And I could see academia can be certainly involved when I can hear you that the focus really needs to be on awareness, education, and prevention.
Yes, I think it's so important that we educate, and prevention is truly the key to how we're going to, combat workplace violence.
Do you have any final words of advice or encouragement to those who may have been affected or witness workplace violence?
So final words are, if you've been a victim or impacted by workplace violence, I really encourage everyone to talk about it, bring it up to their leaders so that we can evaluate and put, when we can, proper procedures and processes in place and create the environment. That might be room design, use different things, right? How do we create the right environment so that we can identify it? I think talking to people is so important, and recognizing that they've had this happen to them so that they can continue to heal, so that they can continue to be the great caregivers that they are. I think working with the schools such as yourself, and I appreciate the opportunity to be with you to talk about such a really very important topic that branches all into so many different fields. And yes, we're here talking about healthcare, but we do need to be mindful about workplace violence in every setting, as we hear about it nationally on the airlines and in some of these other places. But there have been shootings across the country. In healthcare, I think most recently in Texas, that we just have to be aware of our surroundings. And I think training, education, and listening to people is really how we are going to get the message out.
Well, Donna, thank you so much for being our esteemed guest today and for really shedding such a focus and a light on this topic of workplace violence. It's been a while since we've, at least myself and Daria, we've been talking about this, and I really think that bringing it back to light, especially now that we begin the new year, really thank you so much for joining us today and taking time out of your schedule to address this topic and really bring some clarity and also food for thought, and as we move forward and as we educate the upcoming nursing generation.
Thank you, Donna.
Thank you.
Have a great day.
This podcast has been a production of Radio Felician, the voice of the Franciscan University of New Jersey. Visit us anytime at radiofelician.com. Want to send an email? Reach out at radiostation@felician.edu. Radio Felician, the Falcon.